As of September of this year, some 834 persons are living with HIV in St. Lucia. On Tuesday, December 1st, 2020, the island joined the rest of the global community in observing World AIDS Day. Healthcare systems globally have been facing a number of crises amid the COVID-19 pandemic. Local healthcare workers must battle the epidemics of COVID-19 and HIV. Out of the 800 persons living with HIV, some 485 are not receiving the necessary medication for the disease.
Since 1988, the world has commemorated World AIDS Day on December 1st. The 2020 theme is Global Solidarity, Shared Responsibility. 2020 marks 35 years since St. Lucia registered its first documented case of HIV. According to UNAIDS 2019 figures, there are 38 million persons across the globe with HIV or AIDS. As of September 2020 in St. Lucia, there are 834 persons known to be alive with HIV. Only 349 of those persons are taking treatment for HIV. We have come a long way since 1985, from a period where the only treatment on offer was multivitamins. Now we have antiretroviral treatment, also known as HIV medication, that allows persons who are infected with HIV to live well and live long.
Health officials encourage persons to get tested to know their status.
Testing can be requested at any of our community wellness centers or at our partner civil society organizations such as United and Strong Incorporated and the St. Lucia Planned Parenthood Association. Testing is very important to you, for you to know where you are with HIV. Ask yourself the following questions. Are you sexually active? Do you have unprotected sex? When last did you do an HIV test? When last did your sexual partner do an HIV test? Have you talked about HIV with your sexual partner? Are these questions and answers important to you? I ask these questions to remind you that you have control over HIV. You choose to test to determine if you are infected or not.
Officials say that while gains have been made in battling HIV, prejudice, negative attitudes and abuses continue to be directed at persons living with the disease.
Remember, no one is immune to HIV. You do not get HIV from touching, kissing, hugging, handshakes, sharing food, sharing a seat. But if you are sexually active and do not use condoms, you are at risk for getting HIV. There is a well-known saying, man knows thyself. You are responsible for yourself. Protect yourself. If you have HIV and have not started treatment, we are available to get you started. Testing is free and treatment is free. If you have HIV and have not told your partner, protect your partner. Use condoms. Tell your partner. They need to know. They need to get tested.
An estimated 38 million people were living with HIV in 2019. HIV continues to be a major public health threat, and COVID-19 has compounded the situation. Testing, treatment, and access to medication has been disrupted due to lockdowns and health measures. This is a threat to lives and may leave vulnerable populations at greater risk for HIV infections and AIDS-related deaths. Gina Filippi, HTS News Force.